Human Services Committee will come to order. First thing on the agenda is the approval of the agenda. Chair will entertain a motion.
So moved.
Moved by Snell, supported by Williams. Any comments on the agenda? All in favor will please say aye. Aye. Any opposed? Thank you. We are up to public comment. Is there any public comment? Any public comment at all? Public comment is now closed. We now move on to committee items, the minutes. Chair will entertain a motion to approve the minutes.
So moved.
Thank you, Commissioner Snell, supported by Commissioner Williams. Any comments on the minutes? We'll proceed to vote. All in favor will please say aye. Aye. Any opposed? Thank you. Appears to pass. We're now up to appointments. There are two terms expiring on the Department on Aging Advisory Council, currently held by Felicia Richmond and Tom McKinder. We have two applicants, Kimberly Mulvihill and Willie Anderson. What is the committee's preference? I hear a motion to approve Kimberly Mulvihill and Willie Anderson. Is there support?
Support.
Thank you, Commissioner Bear. Any comments on the applicants for the Department on Aging Advisory Council? All in favor of those two applicants will please say aye. Aye. Any opposed? Thank you. We have three openings on the Region 2 Area Agency on Aging. Current... There's a motion, the motion to appoint the three applicants, and it has support from Commissioner Bear. Any comments on the proposed appointees? We'll proceed to vote to move these names onto the full board. All in favor will please say aye. Aye. Any opposed? Thank you. We will move on now to the Lifeways monthly report. I don't see a representative from Lifeways. The report is in your packet, containing the new logo, which is among the things that are in the report. Chair will entertain a motion to receive the report.
So moved.
Thank you, Commissioner Alexander. Support by Commissioner Snell. Any comments on receiving the report? All in favor will please say aye.
Aye.
I beg your pardon. Oh, Commissioner Bear, you have a comment?
Seems to be becoming a bi-monthly report instead of a monthly report.
I'll have a discussion with Mary Beth. Any other comments? All in favor, please say aye. Aye. Any opposed? Thank you. We're now up to the Medical Care Facility quarterly report. I do not see a representative from the medical care facility here. Any committee questions or comments on the financial statements from the medical care facility? Thank you. Is there support?
No support.
Thank you, Commissioner Williams. Any further comments on the medical care facility quarterly report? All in favor will please say aye. Aye. Any opposed? Thank you. The Department on Aging. Danielle is here. Thank you for being here, Danielle.
Thank you. Just to highlight a few things from the April report, of course, we had our Soups On for Seniors event in March, and the event went very well. We raised, Friends of Jackson Seniors and the Department on Aging raised $16,600, so we had $9,500 that came in from sponsors, and then we had two raffles. We played like a card game for those, and took in over $1,000 on the raffles, and both of the winners on those raffles actually donated their prize winnings back to the program, so that was very nice. Our auction that we did took in about $2,300. So overall, I think it was a very good event. We heard positive feedback from the people that attended. The restaurants, we heard good feedback. We had some new restaurants as well. So being our first big event like that, coming back off the pandemic, I think that it was well received. And so we're kind of already going through, the things that we could improve upon, and as we try to plan that event for 2023. With the Friends of Jackson Seniors, they do meet again in June. I anticipate they'll probably donate the full amount back. In the past, what they've done is there might be like between $2,000 to $2,500 in expenses. They go ahead and take that on through some of the other fundraising that comes into their coffers, and they pay for that. So we usually receive the full amount back, and they cover all the expenses that occur from advertising, for purchasing of supplies, for the rental of the facility, the entertainment, and things like that. So again, very successful for us. With the Senior Project Fresh, Market Fresh, this is something that we've done for several years. This is an opportunity for seniors in the community to purchase fresh fruits and vegetables from our local farmers. So we receive about 100 coupon books. This is the first year where they've kind of upped the amount that they're giving to the recipients. So usually it's about $20. You get 10 $2 coupons, and this year they're doing $25 with $5 coupons. And so the seniors can go to farmers that have signed up to partake in that program, and they can purchase vegetables and things like that from that local farmer, and then the farmer gets reimbursed by the state. So again, it helps our local farmers, and it also helps the seniors in the community to get that fresh food and things like that. They're given like a list of information of what they can pick up at the farmer's market. So sometimes the growers are selling a lot of different things, but it is like they actually allow honey because they figure that is something that can be used to help season food, but it's usually generally just all your fresh fruits and vegetables. And we partner with MSU on that. In the past, what we've done is we've had the MSU Extension Office come in, and they'll do like a cooking class and do a demo. I assume we're going to be doing that again in some kind of partnership. So it provides some education as well as letting the seniors participate in that program. With our kitchen, we did end up purchasing a new reach-in freezer. It was an unexpected purchase. So an item went down over the last month, and it was going to cost more to. I was going to say more. It's going to be at least half the amount of the reach-in freezer to get it fixed, up and running. So it was better off. It's a 2009 model to go ahead and just replace it. So with that expense, due to some staff shortages or things like that that are within the budget, the current budget, we're able to go ahead and do that and not and actually absorb that cost right now. So again, as we can replace those things in the kitchen, that just keeps our kitchen up and running. We did that kettle. The kettle's in the kitchen now that we did in the past, and the staff really like it. It's a little bit more ergonomical because they're able to dip into it differently than the higher kettle that we had before. So again, just keeping our kitchen up and running and replacing things as needed is going very well. I added a few pictures from our St. Patrick's Day event that we did at the Senior Center. Again, we're continuing to see seniors coming in for events. I think our numbers are rising in that, so we're very excited about that. We're definitely planning a lot of different programs just to help re-engage the community, keep people socially active. I wanted to add a couple things that came up after I did the report. Country Stitches has always been, their patrons that go in and shop there have been a supporter of Meals on Wheels. And in the past, what they've done is they've used their extra material and they create placemats. So I was just going to show you a few of the placemats. So the seniors get very detailed in what they're creating, a lot of different patterns. So I just brought a few. Definitely there's a varieties for the male and female participants that we have. So we're excited to give these out this week. We have like 251 of them. And what our drivers try to do is they look for people that really can use that pick-me-up. They don't seem to have a lot of family involved. maybe struggling a little bit and would really appreciate something like this. So we're very excited for their continued support of our home-delivered meal service. And we actually also received a donation from the craft agency for $200. Their employees were able to wear jeans on a particular day, and they would donate $5, and those funds would go to support Meals on Wheels. So again, those little things, just making the community aware of our programs, but also it benefits the services. And that's what I have for my report.
Thank you, Danielle. Questions for Commissioner Barrett, please?
Yes.
Hi, Danielle. The Senior Project Fresh, Market Fresh, these $25 coupons so seniors can get out to Michigan farmers markets. Is there anything done, or can anything be done for those seniors that don't drive or can't get around by themselves so they can participate in this?
Yeah, they can actually send a proxy to, since we're doing the applications over the phone, we can do the paperwork on our end and get the coupons to the senior. And then on those coupons, there's a proxy that they can designate that can shop for them.
Thank you.
And I will say that my wife and I attended Soups On for seniors and had a very nice time.
All right, thank you.
Further questions for the Department on Aging? Thanks for the work, Danielle.
All right, thank you.
And now we're up to the Health Department. Kristen is here, see? Welcome. New format for your report today.
Yes, I took the liberty this month of trying to pull some of the words, trying to make it a little easier to read, a little easier to see the data and information in there. I looked back, actually, and that report has been being done the same way for at least 10 years. And so instead of bombarding you with all of that extra information, I still have all of that information, but can pull out some pieces that are more, make it a little easier for you to read and, see the highlights of what we actually want you to see. But like I said, that report still comes to me in the exact same way, so I still have all of the background data and information from it. So starting with the division, the Health Education and Health Promotion, you'll see the WIC information and their numbers there. The government just extended the cash value benefits through July, so WIC clients will still continue to receive an additional amount of money to purchase fresh, frozen, and canned fruits or vegetables. So the numbers are there. Each child receives $24, and each mom, pregnant or breastfeeding, receives breastfeeding, non-breastfeeding receives $43, and breastfeeding receives $47 per month. And that's additional on top of what they would have received previous to that. So as long as that continues, that still goes on their cards. The national infant formula shortage still continues to be a problem. The state WIC office has authorized, and the federal government has authorized, instead of just being able to, for WIC clients to get Similac, they've now expanded that so they can get some other different alternative formulas because that's their primary source of nutrition for many of these infants. And with the Similac recall, that caused, Similac was the primary provider and contractor with WIC, so WIC clients previously could only get Similac formula, but now because of the shortage of it. And if you recall, back in the fall, there was already a formula shortage due to distribution issues, so this recall that happened in February actually expanded the problem that we have with the formula shortage. And I heard on the radio this morning that they're still talking about how difficult it is, even for non-WIC clients, to get formula. So last month was National Nutrition Month, and we had some outreach events. You'll see there our dietitians gave some programs at the libraries and a few other events. Moving on to some of our outreach programs for teens, the Empowering Youth program. and the teen outreach program. We've continued with our regular classes with them. Additionally, JPS schools are on a trimester, so we started new, with their trimester, started new classes with them. In the regular health education for the SNAP Ed grant, we are currently working to continue and expand on the SNAP Ed program with Henry Ford. That is a nutrition program where we teach teach Head Start and preschoolers and work with families to promote nutrition and nutrition education and teach them. Some of our educator will teach them, do a presentation on how to cook a different, like an avocado, and show them, a child might not like an avocado, but show them different preparations and things like that. And a lot of times they'll send then recipes and things like that home with the students. Our medical marijuana grant for lockboxes, our health educator there has been working to partner with different groups to get the lockboxes out. They recently started working with our WIC clients. So WIC has the information, so when those clients come in, if they're interested, they can watch the video, take the quiz at the end of it, and the WIC clerks can actually hand out the lockboxes right then and there for an in-person client. For a remote or telehealth client, they will then send that information to the health educator, who can then set up a time for that participant to receive a lockbox for their marijuana. So working on different ways to get those lockboxes out into the community. So because as marijuana is legal, we need to make sure we are doing our due diligence to make sure it's safe and in the right hands. Lead, we've talked about lead a few times over the past couple months. The Lead Care 2 test kits that we use in the WIC clinic have been authorized back. They were recalled. They are now allowing us to use those again, so we're ordering new supplies. So lead testing should start increasing, at least within the health department. And then our lead health educator is again working to promote additional lead testing with primary care doctors and in the community itself. So hearing and vision programs continue in the schools. As you know, they were out of the schools for a couple years during COVID, or in schools limited times during COVID. So now they're catching up on all of those from the past couple years. Preventative health services, you'll see numbers there on our sexual health and communicable diseases. Flu is still in our community. It's higher this year than last year, but still I don't think it's reached the levels of previous years. COVID numbers are all there. Several pages of the COVID documentation were previously listed in this report. Those are all, I didn't include them in this anymore because they are already, if you want that information, it's readily available and updated daily on our website. So instead of, giving you page after page of graphs, and in this document, if you want it, I can send it to you, or you can look on the website and those are updated. I actually said daily, but we have actually just changed this past Wednesday our COVID reporting. We used to report on a daily basis, but to go along with what the state is now doing, we are reporting on a weekly basis because the numbers aren't changing and fluctuating. On a daily basis, it's our trends to look at are easier to see looking over a longer term. So following, again, the state and what MDHHS is reporting, we are now reporting, the report will come out Wednesdays. We still, again, internally track the numbers on a daily basis, but we are reporting out on a weekly basis, and those will come out on Wednesdays. Community health. Our programs, you'll see numbers there for children's special health services, and again, lead case management. This is another area where we've kind of found a disconnect, especially over the last couple of years, as the lead hasn't been being drawn in our WIC clients, and there's been just a lower prevalence of clients within the building. Trying to put that lead case management and the lead health educator back in connection with each other, so they're working together and collaborating on not only the outreach portion, but the case management side of that. Because the case management is a nurse who will go in with, if there is a high lead level, and work with the parents and families of that child. Environmental health, you'll see on the chart on there, we still continue to have high levels of activity through the beginning of 2022, higher than previous years, not quite as high as last year, but the numbers are still there. So our sanitarians are busy doing, especially now this time of the year where they do food plan and restaurant inspections and the start of that. And then that continues throughout the year, but there's a lot of food plans that start in April. And then as this nice weather starts, we start to get all of our our septic and well inspections ramp back up this time of the year. We did receive 2 grants to monitor mosquito and tick. These are the same programs that we've done last year. We are working on hiring. I believe Don is looking for the intern that came in and did the mosquito program last year, and they'll work May to the end of September to do the mosquito surveillance. Radon test kits, we talked about that. Don was actually, I think February was radon month, and he did a presentation at JTV, or a visit at JTV, to talk about radon tests and the availability. You can come right to the health department and pick up a radon kit. And then the mobile home village continues to be on our radar as we, work with them. We are not the overseer of them, but we work with them and coordinate with Eagle to make sure that water issue at Arbor Village is being taken care of. Additionally, I added on a section here. We have 3 divisions in the health department: the health education, health promotion, preventative services, and then the environmental health. I added a section on here to talk about, because there's some things that I think are sometimes overlooked in our previous reports. And so emergency preparedness I've added on here, and then I'll also continue to add things that are just going on generally within the health department under the administration section. But for the emergency preparedness, if anyone's been to the grocery store and bought a dozen eggs, you'll see that the price of eggs has gone up, and that you've probably heard on the news as well, due to the avian influenza. Right now, that is an emergency preparedness issue, and we continue to watch that within the environmental health and emergency preparedness until it becomes hopefully it doesn't infect humans. Then our preventative services director will get involved with that, and then it'll become a communicable disease. But hopefully it doesn't go that way and it stays, and we just pay a little more for eggs right now. So we're watching that. And then last week, just worth noting, last week we have general staff meeting every other month, and last Wednesday we had a presentation for active shooter training. A few years ago, prior to my time, prior to anything that I knew of, they did an actual simulation of an active shooter within our building, where they fired blanks and people physically moved throughout the building. This time, we just had a presentation from one of the sheriff's deputies who came in. I was not in attendance at that, but everything I've heard, he did a great job, presented for about an hour and a half, questions, answers, took them through kind of what to do. There was a lot of questions after the Oxford school shootings, and we have a lot of new people in our building, so there were some concerns on things like that. So we try to use those general staff meetings for a purpose rather than just relaying information. So we use that in our emergency preparedness, set that up for us. Lastly, the only thing I'll say is last week was Public Health, National Public Health Week. So there's some information in there about what public health is, public health in the spotlight, what exactly it is we do. We had website, or excuse me, a Facebook promotion campaign kind of last week that used some of our own information, some of our own programs and exactly what it is we do, as well as some of the slides and things from the National Public Health Week organization. But again, just trying to keep, one thing I've noticed a lot since I've been with the health department is if I say where I work or who I work for, immediately people think COVID, and that's the only thing they think about. But, public health is far bigger than COVID. COVID is a communicable disease in a program within the health department, and one small thing that we're responsible for. So you'll see there's just a list of things that we're responsible for. And in doing that and searching for, something to put in here, and there's an attachment on the website as well that talks about the Michigan Public Health Code and our responsibilities as the health department. So that is all I have.
Questions for the health department? I would ask Kristen, as to Arbor Village, if they're either successful or not successful in hooking up their well, will there be a way to know whether they did what Eagle has required them to do? Will Eagle inform us
Yes,
one way or the other?
Don is working and in collaboration with Eagle. So he checks in with them periodically, basically, just to see what the standpoint, again, we don't have any oversight over them, but they are working with us and us as a local kind of resource to keep on them, to keep on
But we can
Arbor
expect
Village.
Eagle to do
Yes.
what they're supposed to
Yes.
do. Yeah.
Yeah, and Eagle has, the last I specifically talked to Don about it, he had followed up. They were waiting on a report, not a report, a permit. They had received the permit, but there was an addition or something that was being added. So it was in Eagle's hands, but I believe that's been back to
Back to the park
Arbor
now.
Village. Mhm.
Okay. The Spring Arbor Township Supervisor is keenly interested in how that goes. Okay, thank
Yes,
you.
it's a timeline that's a little delayed from what we initially
Yeah.
had hoped and put on the table back in November, December, but work is happening, progress is happening.
Very good. Any further questions for the Health Department? Chair will entertain a motion to receive the report. Moved by Alexander, support by Snell. Any further questions? All in favor will please say aye. Aye. Any opposed? Thank you. And now we move on. Thank you, Kristen. Appreciate it very much. And now we move on to the claims. Chair will entertain a motion to pay the claims. Motion by Williams, support by Alexander. Thank you. Any questions on the claims? They're coming your way, I think, Tony. And all in favor will please say aye. Aye. Any opposed? Thank you. Please take note of the DHHS board minutes that are in your board packet. And the reporting schedule next month: Department of Aging, Health Department, Lifeways, Region 2, AAA, and Veterans. And we'll have a discussion with Lifeways and the medical care facility on their attendance today. Public comment now is open. Any public comment? Any public comment? Public comment is now closed. Now we're up to committee member comments. Any committee member comments? Hearing none, we will adjourn at the call of the chair.